Well, we've been working with community-based partners and with the state agency, the Department of Social Services, to promote the HUSKY program in such a way that families around the state of Connecticut would know that the program is there for them when they need it and is there for their children. We have been monitoring the data on the uninsured in Connecticut from year to year, and so we have an idea of the scope of the problem. We now have town-level data on uninsured so that we can use that to target particular communities that have higher uninsured rates among their children and their families. And then we've been working with our community-based partners to make sure that the information gets out to the families that need the program. One of the features of a high-quality program is that children and their parents can get enrolled and stay enrolled in the program. And we know from the information that we get from community leaders and individually from families that sometimes staying in the program is a really big challenge. So we've been focusing on monitoring, counting new enrollees coming into the program, because we think that's a pretty direct measure of the success of the outreach that's being done. And then we've been also comparing that count of new enrollees to the net increase in the program, and finding that there's far more new people that come into the program than the program growth would suggest. So that leads us to believe that that families have a difficult time staying enrolled in the program, that they go in and out. And in fact, nationwide data supports this. What we have found in the performance monitoring that we've done is that at the time of renewal, children and their parents are very vulnerable to losing coverage and having at least a gap in coverage, if not a loss of coverage altogether. So for years we've been monitoring calls that come into 211 United Way through their HUSKY info line, so that we have information about how the program is actually working for families. And for a long time we've listened to the calls that come in from families that have infants that are turning 1 year of age. Babies lose coverage. So we began to investigate this using the data that we have by virtue of this performance monitoring project. And what we found was that for those babies that were enrolled in a newborn coverage group that guaranteed them 1 year of coverage under federal law, at the end of the year they had to be renewed for another coverage group. Because of the antiquated computer system that underlies the eligibility system, that's a manual redetermination. There's nothing automatic about that baby automatically going into another coverage group. The family gets a notice about 30 days in advance that says, among other things, you are not the right age for this program. So the family's confused. I think even in English that's confusing if you're English speaking, but certainly for families that have any literacy issues or linguistic access issues, that's a pretty confusing message. So what we've done is to investigate the problem and put out that information to quantify the scope of the problem, to describe the features of the problem, like this notice that's so problematic, and then to use the information to formulate recommendations for the department on how to fix it. In the meantime, we've also worked with our Covering Kids network to make sure that all of those community-based providers that work with us are well informed about the program, so that those workers know that if they have families with babies in their care, that they need to pay special attention to the coverage in the HUSKY program as that baby's approaching 1 year of age. We have a project that Connecticut Voices for Children sponsors called Covering Connecticut's Kids and Families. It's the successor of a Robert Wood Johnson Foundation funded project that began here at the Hartford Foundation. This project brings community-based outreach workers together on a quarterly basis to meet with Department of Social Services staff and to exchange information about program changes and what's working and not working for the families that the workers are working with. So that's been a very rich source of information for us about what works in the program, information for the Department of Social Services about what works and doesn't work, and then an opportunity for us to ensure that they're really well informed about the program and the many and frequent changes that there have been over the years. We have been successful over the years in working with the state agency and with the legislature in making program improvements. For example, the 2009 reauthorization of the Children's Health Insurance Program established a program of performance bonuses for states that successfully increased their enrollment in their programs. The state also had to have taken steps to simplify the application process and the renewal process. There were actually 8 steps listed in the legislation, and each state that was seeking a performance bonus had to adopt at least 5 of the improvements, the strategies. Connecticut had 4, not 5. So 2 to 3 years ago, we began discussions with the department about adopting an additional simplification strategy which would benefit the program overall and would lead to Connecticut being qualified for a performance bonus. The department was very responsive to that. They worked with the Office of Policy and Management, went to the legislature in its special session that fall and proposed legislation to adopt this one additional simplification strategy. Connecticut then had 5. Connecticut successfully implemented the 5th strategy. Enrollment continued to grow, in part because of the simplification strategies and in part because of the good outreach work at the community level. Connecticut was awarded a performance bonus of $5.2 million on December 30th by the Department of Health and Human Services. So that's a really good example of collaboration between the state agency, the advocates and performance monitors, and the community-based people that made sure that children and families came into the program and stayed in the program. I think our experience here in Connecticut and nationwide has been extremely important for the health reform effort as it goes forward. The national health reform effort and whatever happens at the state level will be built on top of the existing program. So Medicaid will continue. The Children's Health Insurance Program, which is in Connecticut is HUSKY B, will continue. And families, children and families will go back and forth between those programs as their financial circumstances change. What we've learned in our work in the HUSKY program is that there's a good deal of financial mobility and fluctuation in these families. They will one day qualify for one program and in the future will qualify again for a different program. By virtue of them going back and forth all the time, they're quite vulnerable to gaps in coverage that can have a significant impact on ongoing care. So we are taking every opportunity we have to talk to policymakers about the importance of making sure that the eligibility systems are synchronized, that information from one program, from eligibility determinations in one program is used for another program, including even sharing information across types of programs like the food stamp program or early childhood programs. We also know from the national literature that 1 in 4 uninsured children today was in the Medicaid program a year ago, in the past year. So we know that addressing the problem of uninsurance means keeping kids on the program, keeping adults, parents, pregnant women, and low-income adults on the program. so that they have continuity in their access to care.